Hey guys, it's Maintenance Monday. We're at CrossFit Honors. Dr. Teague's going to be working with me on some specific exercises for knee pain or to prevent knee pain.
All right, today we're at CrossFit Honors in Southeast Ohio, Cambridge. One exercise I typically like to do is called the TKE, or terminal knee extension. A lot of times with athletes, either in CrossFit or other sports, they have achy knee, or they might have an imbalance in the knee of the quad muscle. So right here you have your VMO. That's typically the culprit of dysfunction in a knee, in a squat with people's knees. So today, all you need is a mobility band, green, whatever strength you feel that you're going to get enough tension. We're going to loop your band through. So come around the rig or something sturdy, loop it through, get the tension. The athlete is then going to put the band right behind the knee and from the side. He's going to get enough tension to where he can feel comfortable. All right, he's going to have his chest up. All weight is going to be onto the banded leg, and he's going to fire that leg straight down, driving the heel into the ground and trying to flex this quad as hard as he can, and then relax. And fire again.
How long am I holding it for?
2 seconds at the end, terminal end range, and good. We want to shoot for 20 reps. If you feel that there's any discomfort behind the knee, there are other modifications. You can put a knee sleeve on that helps with the pinch in the back of the knee.
Or you can just man up.
Or that. And again, work to 20 repetitions, 2 to 3 times before exercise, after exercise.
This is something for me. As a football player, I had ACL surgery, so this is something that I need to do daily just as maintenance to take care of my knees. It's also something that if my knees are ever a little achy or giving me problems just from high volume training, I'll implement it into my accessory work for the day.
And it should always be done on a regular basis. Don't just do this once in a week and then skip a couple weeks. This is a great exercise to implement into your training on, like you said, a daily basis. So
if you were to recommend, how long would you recommend to do it in terms of how many days a week?
So at first try to implement it 3 days a week, either before or after exercise. If you feel comfortable and you want to keep doing it, do it before and after exercise. Like I said before, 20 repetitions. Yeah. So again, when you get to that position, firing that heel into the ground and flexing that quad, try to hold for 2 seconds and then relax into the next rep, up to 20 to 30 reps, whatever you want to feel. You will feel a deep burn in your medial quad, and that's really helping to stabilize that patella as it slides through that femoral groove right at the the kneecap area. So if this, which typically happens with a squat, the athlete will really have either a sticky or overactivated lateral quad, and it can pull that patella out of that little groove that it runs through. So when that occurs, you get all kinds of conditions, patellofemoral pain in general. And that's one problem I usually have with most of the athletes I work with is the patella pain. But this, again, you don't want to ever have that happen, so that's why this is a great accessory exercise to add into your training. Or if you do have the knee pain, start implementing it as soon as possible.
It's also something that a lot of athletes use to prevent any type of knee injury from occurring. In CrossFit, we do a lot of specific movements towards squatting, and this is preventing that overextension in the knee that can happen from an athlete making a quick cut. In CrossFit, we do shuttle runs, we do sprinting from time to time, but in more sports like football and soccer, where you're cutting more often, this is going to be something that can prevent an ACL injury from occurring, which it's something I wish I would have been implementing into my training when I was in high school and early on in college. It could have prevented
before you had the three knee surgeries.
Before I had surgeries. So if you're experiencing any type of knee pain right now, this is something you want to start implementing. I like to do it before my training just because I feel like it really warms my knees up. Then I'll put my knee sleeves on and they feel ready to go. Like I'm firing those muscles around that area, and it allows me to kind of move right into my Metcon, and later on throughout the day, I feel better. So if you're not implementing it, you should be.
Build the concrete knee.
Yeah, absolutely.
That's it for today.
Maintenance Monday. See you next week.